Hello, my name is James Vaughn, and I'm with Premier Insurance Services located in Spring Hill, Florida. Today we'll go over how to enroll Medicare. Next, we'll discuss what's covered in Parts A and B. Then we'll go over what a Medicare Advantage plan is, what a Medicare Supplement plan is, and finally, what a prescription drug plan is. We will also cover extra help, what it does, and how to qualify for it. Let's go over the step-by-step process for Medicare enrollment. If you have elected to take Social Security before turning 65, you should automatically get Parts A and B, but you can call the Social Security Administration to confirm at 1-800-772-1213. This information is intended for people who are turning 65 and have not yet elected to take Social Security. Step 1. Gather necessary information. Your Social Security number, birth date, proof of U.S. citizenship or legal residency, and current health insurance information. Step 2. Visit the Social Security Administration website at www.ssa.gov. It should look something like this. Click in the middle of the page. You will see it say Sign up for Medicare. This will take you to the next page. Once you get to this page, you will click on Apply Online. Right below where it says Sign up for Medicare, Step 3, start your application. Please click on the Accept the Terms of Service button and then click on Next. On the Apply for Benefits page, choose Start a New Application. Step 4, fill out the application. Follow the prompts to provide your personal information, including if you are applying for yourself or helping someone else. Then it will ask if you have a My Social Security account. If not, it will ask about your current address. Then please hit Next. At this point, you will have 3 different options for creating an account. You can choose either of the first 2. I would recommend the first one because it creates a login that can be used to check your Social Security benefits in the future. Once you have created an account, please continue to fill out the application with your Social Security number, birth date, and current health insurance details. Step 5. Review and submit. Review your application for accuracy. Submit your application online. Step 6, confirmation. You will receive a confirmation from the Social Security Administration. Keep an eye on your mail for any additional information or requests for documentation. Step 7, follow up. If you haven't heard back within a few weeks, you can contact your local Social Security Administration office for assistance. In our next section, we are going to go over Medicare basics, what Part A covers and what's not covered, and what Part B covers and what's not covered. My goal is for you to better understand what coverage you receive from Medicare so you can choose what plan best fits your needs and budget. Let's talk about Medicare Part A, also known as hospital insurance. What Medicare Part A covers: inpatient hospital care, semi-private rooms, meals, general nursing, and drugs as part of your inpatient treatment. The deductible is $1,600 per benefit period. Days 1, 60. You pay a $0 copay per benefit period. Days 61, 90, you pay $400 per day. Days 91 and beyond, you pay $800 per each lifetime reserve day up to 60 days over your lifetime. Beyond lifetime reserve days, you pay all costs. Skilled nursing facility care. Post-hospital care in a skilled nursing facility under certain conditions for a limited time. Days 1, 20. Medicare covers it at 100%. Days 21, 100, you pay $200 per day. Day 101 and beyond, you pay all costs. Home health care, part-time or intermittent home health care services, if you're homebound and your doctor certifies that you need them. No copay for home health care services. 20% of the Medicare-approved amount for durable medical equipment. Hospice care, also known as end-of-life care, has no copay or deductible for doctor services, nursing care, pain relief medication, and support services for the terminally ill. Small copay for outpatient drugs and respite care. Blood. If a hospital gets blood from a blood bank at no charge, you won't have to pay for it. First 3 pints per calendar year, you pay all costs. After 3 pints, you pay $0 for additional pints. What Medicare Part A doesn't cover: private duty nursing, services provided by a private duty nurse. Televisions or telephones in your room. Convenience items are not covered. Private rooms, except when medically necessary. Personal care items such as razors, slipper socks, etc. Long-term care. Most long-term care costs are not covered. Custodial care, if it's the only care you need and you don't need skilled nursing or rehabilitative care. Now let's look at what's covered by Part B. Medicare Part B, also known as medical insurance. What Medicare Part B covers: doctor services, includes medically necessary services or supplies needed to diagnose or treat your medical condition. Copay, 20% of the Medicare approved amount after you meet the deductible. The deductible is $226 per year. Outpatient care, covers services and supplies that you get as an outpatient. Copay, 20% of the Medicare approved amount after you meet the deductible. Preventive services, includes services like screenings, vaccines, and yearly wellness visits to prevent illness. There is no copay for most preventive services. Durable medical equipment, DME, covers items like wheelchairs, walkers, and hospital beds ordered by your doctor for use in your home. Copay, 20% of the Medicare approved amount after you meet the Part B deductible. Mental health covers outpatient mental health care, including services from psychiatrists and clinical psychologists. Copay, 20% of the Medicare approved amount after you meet the deductible. Lab tests, blood tests, urinalysis, and other tests ordered by your doctor to diagnose or monitor a medical condition. Usually no copay if your doctor accepts assignment. What Medicare Part B doesn't cover: routine dental care, includes cleanings, fillings, tooth extractions, dentures, and other dental devices. Vision care includes routine eye exams, eyeglasses, and contact lenses. Hearing aids and exams for fitting includes the cost of hearing aids and exams for fitting them. Cosmetic surgery, unless it is medically necessary due to an accident or to improve the function of a malformed body part. Acupuncture treatments for pain relief or other reasons. Long-term care, extended care services provided in nursing homes or assisted living facilities. Prescription drugs, most prescription drugs are not covered under Part B. You need a separate Medicare Part D plan for drug coverage or get coverage included from a Medicare Advantage plan. That's a quick overview of what Medicare Part B covers and doesn't cover, along with copays and deductibles. Always check specific details and conditions as they can vary. Now we're going to talk about Medicare Advantage plans. Medicare Advantage, also known as Part C, is an alternative to original Medicare provided by private insurance companies approved by Medicare. These plans offer the same coverage as original Medicare, Parts A and B, but often include additional benefits. Key points about Medicare Advantage: all-in-one coverage. Medicare Advantage plans bundle together Part A, hospital insurance, Part B, medical insurance, and often Part D, prescription drug coverage, into a single plan. Many Medicare Advantage plans offer extra benefits that original Medicare doesn't cover. These can include dental, vision, hearing, and even fitness programs, as well as an over-the-counter benefit that can be used for a wide range of health items. With this benefit, you receive a quarterly or monthly allowance that you can use to purchase eligible over-the-counter medications and health products. This means you can buy items like allergy medications, vitamins, pain relievers, and first aid supplies without spending your own money. Some Medicare Advantage plans have a Part B giveback. It's a benefit that's offered by some Medicare Advantage plans that helps reduce your monthly Part B premium. Essentially, the plan carrier will pay some or all of your Part B premium. This is a great benefit for those who are on a fixed income or don't need a plan with a lot of extra benefits. Cost structure. Medicare Advantage plans usually have a different cost structure than original Medicare. They may have lower premiums but higher out-of-pocket costs for certain services. Some plans may also have an annual out-of-pocket maximum. These plans often require you to use a network of doctors and hospitals to get the lowest costs. Some types of Medicare Advantage plans, like HMOs, require you to choose a primary care doctor and get referrals to see specialists. Managed care. Medicare Advantage plans can help manage your overall care. They can include care coordination and disease management programs to help you stay healthy and manage chronic conditions. In summary, Medicare Advantage plans offer a comprehensive, all-in-one alternative to original Medicare, with the potential for extra benefits and managed care, though the cost and provider network requirements may vary. But many Medicare beneficiaries like the benefits associated with the Medicare Advantage plans. Now we are going to talk about Medicare Supplement plans, also known as Medigap, are insurance policies sold by private companies designed to cover the gaps in original Medicare Parts A and B. These plans help pay for out-of-pocket costs that Medicare doesn't cover, such as co-payments, co-insurance, and deductibles. Key points about Medigap plans. Medigap plans are standardized and labeled with letters A, B, C, D, F, G, K, L, M, and N. Each plan offers a different level of coverage, but the benefits of each plan are the same across all insurance companies. While Medigap plans cover the gaps in original Medicare, they often do not include additional benefits like prescription drug coverage, vision, dental, or hearing. For drug coverage, you would need a separate Medicare Part D plan. Costs: you pay a monthly premium for your Medigap policy, in addition to the Part B premium you pay to Medicare. The cost of Medigap plans can vary between insurance companies and locations. Choice of providers. Medigap plans generally allow you to see any doctor or specialist who accepts Medicare without the need for a referral. Some Medigap plans provide coverage for emergency health care during foreign travel, up to plan limits. As long as you pay your premium, your Medigap policy is guaranteed renewable. This means the insurance company can't cancel your policy based on your health condition. Who might benefit from a Medigap plan? Beneficiaries who want predictable out-of-pocket costs. Those who travel frequently and need coverage outside the U.S., individuals who prefer the freedom to choose their healthcare providers without network restrictions. In essence, Medigap plans can be a valuable option for those looking to limit their out-of-pocket expenses and have more comprehensive coverage than what original Medicare alone provides. We're going to talk about Medicare prescription drug plans, also known as Medicare Part D, for the year 2025. Medicare Part D is a prescription drug benefit program offered by Medicare-approved private insurance companies. It helps cover the cost of prescription drugs and is available to everyone with Medicare. Key points about Medicare Part D for 2025. Enrollment. You can enroll in a Medicare prescription drug plan when you first become eligible for Medicare, during the initial enrollment period, IEP. You can also join during the annual enrollment period, AEP, which runs from October 15th to December 7th each year. Coverage. Each Part D plan has its own list of covered drugs, known as a formulary. These drugs are placed into different tiers, with each tier representing a different cost. Typically, the lower the tier, the lower the cost of the drug. Generic drugs are usually in the lower tiers, while brand name and specialty drugs are in higher tiers. Costs. Costs can include monthly premiums, annual deductibles, and co-payments or co-insurance for each prescription. The exact costs vary depending on the specific plan you choose. You may have heard of the donut hole. The coverage gap has been removed for 2025. There are now 3 Part D prescription drug coverage stages: an annual deductible stage, an initial coverage stage, and a catastrophic coverage stage. Catastrophic coverage, new for 2025, $2,000 cap on covered Part D drugs. All Medicare plans will include a $2,000 cap on what you pay out of pocket for prescription drugs covered by your plan. If your out-of-pocket spending on covered drugs reaches $2,000, including certain payments made on your behalf, like through the Extra Help program, you'll automatically get catastrophic coverage. That means you won't have to pay out of pocket for covered Part D drugs for the rest of the calendar year. I just want to make it clear that prescription drug plans have different formularies. You can see a big difference in drug cost. And if a drug isn't on the formulary, it typically isn't covered, unless the carrier grants you an exception. If the carrier doesn't cover the prescription, your out-of-pocket cost doesn't count towards the $2,000 max out-of-pocket. This also applies to prescription coverage in Medicare Advantage plans. Before I finish up, I want to go over the Medicare Extra Help program, also known as the Low Income Subsidy, LIS. This program is designed to help people with limited income and resources pay for Medicare prescription drug costs. What is Extra Help? Extra Help is a Medicare program that helps cover the costs associated with Medicare Part D prescription drug plans. It can significantly reduce your out-of-pocket expenses for medications, making it easier to manage your healthcare costs. Key benefits of Extra Help: reduced premiums. If you qualify for Extra Help, you may pay little to no premium for your Medicare Part D plan or reduce the cost of your Medicare Advantage plan if there is a cost associated with the prescription part of the plan. Lower co-payments and co-insurance. Extra Help can lower your co-payments and co-insurance for prescription drugs. For example, in 2025, you might pay as little as $0 for generic drugs and up to $11.20 for brand name drugs. No deductible. With Extra Help, you won't have to pay the Medicare Part D deductible, also no late enrollment penalty. If you qualify for Extra Help, you won't have to pay a late enrollment penalty if you join a Medicare Part D plan after your initial enrollment period. Eligibility for Extra Help: you must meet certain income and resource limits. The eligibility criteria are based on your income and assets. An individual's income limit in 2023 is $22,590. For a married couple, income limit is $30,660. Income limits for extra help are based on your adjusted gross income as reported on your tax return, and you may need to provide documentation to verify your financial situation. Some people may qualify automatically while others need to apply. How to apply? You can apply for extra help online through the Social Security Administration's website, www.ssa.gov/medicare/part-d-extra-help, and click where it says Apply Online, or by calling their toll-free number at 800-772-1213. It's important to apply as soon as you become eligible to ensure you receive the benefits you need. You can apply for extra help anytime you want. I suggest doing it as soon as you qualify for Medicare. If you are denied, you can apply in the future if your income or assets have changed to meet the requirements to qualify. I would like to thank you for watching my video. I truly hope you found it helpful with your Medicare enrollment. If you need assistance with finding a Medicare Advantage plan or a Medicare Supplement plan and prescription drug plan, please feel free to reach out to me directly by scanning my QR code. From there, you can look at Medicare plans, compare costs, go to my website, or download my contact information. I look forward to speaking to you in the future, and if you found this video educational, please like, share, and leave a comment. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Not affiliated with or endorsed by the government or federal Medicare program, participating sales agencies represent Medicare Advantage, HMO, PPO, PFFS, and PDP organizations